Hello, my name is Jen, and I am one of the pharmacists at the Brandon Hospital. And today we are going to talk about cardiac medications. Some of you may have had a few new medications started while you were in the hospital, and starting a new medication can be overwhelming. So today we're going to discuss some of the common medications that you could be on and why they're important to take. And hopefully we can answer any questions that pop up as we go. So the question you might be asking is, why should I be taking all of these medications? So our main goals here are to increase survival and increase your quality of life, so to live longer and happier. So these medications will help you to maintain a regular heartbeat and adequate blood flow and oxygen supply to your heart, and they will help to reduce your blood pressure to prevent further damage to your heart. So what do we know? We know that 1 in 5 prescriptions are not even filled, and only 3 out of 4 patients fill all of their medications. So what we've found is that an informed patient is more likely to take their medications as prescribed. So that's why we want to help you figure out what each of these medications is actually for. As for consequences of not taking your medications as prescribed, they do find that patients who filled none of their prescriptions had an 80% risk of death in the first year following their heart attack, and only filling some of the medications led to a 40% increased risk of death in the first year. So what are some of the common medication classes that we're talking about? I will go into more detail in the upcoming slides, but we have antiplatelets, anticoagulants, statins, beta blockers, ACE inhibitors or ARBs, and nitroglycerin. If you have a medication list with you, please pull it out and follow along, and you might recognize some of these names. When we combine antiplatelets, beta blockers, ACE inhibitors, and statins, that combination of 4 medications will provide a 75% reduction in the risk of having a second cardiovascular event. So the first class that we'll talk about is the antiplatelets. So on this slide, you'll see that in red is the generic name of the medication that's a little bit harder to pronounce, and underneath in blue is the brand name. So how long you stay on these medications will depend on your clotting risk versus your bleeding risk, and it's your doctor's job to find that balance. So clopidogrel will often be on board for 1 to 3 years after a cardiac event, and aspirin is usually on board indefinitely after a cardiac event. Now we're just going to watch a video on how aspirin works, just to help you guys visualize.
Your heart pumps blood to your entire body through a network of blood vessels known as the circulatory system. Your blood supplies the cells in your body with the oxygen and nutrients they need. If you've had a heart attack, or stroke, or have angina, peripheral arterial disease, or coronary artery disease, your doctor may prescribe you aspirin. Aspirin reduces your risk of blood clots. A blood clot is made up of fibrin, long strands of protein that form a net. Platelets and cells clump together and stick to this net, forming a clot. Aspirin interrupts the clotting process by stopping an enzyme called COX-1 from working. This interruption makes platelets and cells less sticky, so they can't clump together and form a clot.
Hopefully that video will help you to visualize some of the things that we are going to be talking about now. The first step of blood clot formation involves platelets sticking together in response to an injury, and our antiplatelet drugs, such as aspirin, help to prevent the platelets from forming these sticky plugs within our blood vessels. The benefit of antiplatelet medications is that they help to reduce the risk of a heart attack, stroke, and death by 25%. And if any of you have had a stent implanted, you will be on an antiplatelet medication. This is because stents increase the blood clot risk, as your body sees the stent as an injury to the blood vessel itself. Antiplatelet medications help to prevent the blood from forming a clot inside that stent. This allows the blood vessel to heal over the surface of the stent. As for side effects to antiplatelets, you might find that you are bruising and bleeding more easily than usual. It's okay if you are noticing bruises here and there. However, if you are having cuts that won't stop bleeding, or if you're finding blood in the toilet after you go to the bathroom, any blood in your urine or stools, any blood in your vomit, those are red flags that we would direct you to go to the emergency room and tell them about that immediately. That would be more rare, but it is something to be monitoring for. Additionally, GI upset. So that includes things like nausea and diarrhea. So if you are finding that your antiplatelet medication is irritating your stomach, then taking it with some food can help. The next class of medications that you may or may not be on is called anticoagulants, and those are what we are often calling blood thinners. So there's 3 different types that you might be on. So the first one is warfarin, or Coumadin would be the brand name for that. The second type is what we call the direct oral anticoagulants. So this includes rivaroxaban, apixaban, those are the more common ones. And the third type would be a heparin or a low molecular weight heparin, such as dalteparin. A few of the indications for anticoagulants include atrial fibrillation, venous thromboembolism or blood clots, prosthetic heart valves, or a left ventricular thrombus or blood clot. These are conditions that have an increased risk for clotting to happen, so anticoagulants are prescribed just to reduce this risk. How do anticoagulants work? The second stage of clot formation involves fibrin entangling platelets to form a blood clot. Anticoagulants work on different clotting factors to inhibit the platelet activation and fibrin clot formation. Anticoagulants help to prevent the formation of new clots and prevent existing clots from getting bigger and reduce the risk of embolization. So that's when these clots break free and travel down the blood vessel and get lodged somewhere where we don't want it to, such as our vital organs. The main side effect of anticoagulants is the increased bleeding risk. So if you are noticing more frequent or longer lasting nosebleeds, then that would be something to be mentioning to your doctor. If you're noticing that you're bleeding from your gums, a soft bristled toothbrush and just being a little bit more gentle when you're brushing your teeth can help. And as I mentioned earlier, similar to the antiplatelet medications, you will be bruising more easily as well. And again, any blood in the toilet after you go to the bathroom is a red flag. Get to the emergency room. Blood in your urine or your stools can actually look like coffee grounds. Now we are going to talk about the first medication in the anticoagulation drug class, so that would be warfarin. We're going to just watch a little video here on how it works.
You may be taking warfarin if you're at risk of a stroke or have heart valve disease or atrial fibrillation, AF for short. Warfarin is an anticoagulant, which is known as a blood thinner. This is because it makes your blood less likely to clot and cause life-threatening blockages in your blood vessels, such as a stroke or a clot that has traveled to the lung. For a blood clot to form, you need vitamin K. This is produced by the liver and makes blood cells and platelets stick together and form a seal. Warfarin works by interfering with the production of vitamin K. This means blood cells don't stick together as quickly, reducing the risk of life-threatening clots forming. If you receive a hard blow or deep cut to your body, you may notice that you'll bruise more easily and that it will take longer for a cut to stop bleeding.
Anyone who is on warfarin knows that the annoying thing about that particular medication is how often you need to get blood tests. So these blood tests are checking how long it takes your blood to clot. So This is actually called your INR. The INR target for most people will be between 2 and 3, or between 2.5 to 3.5 for anyone with a prosthetic valve. There are different factors that can affect your INR, such as your diet, which we'll go into more in a minute, medications, so plenty of drug interactions, and also if you're fighting off an infection, such as a cold or some other type of virus, that can throw your INR out of whack as well. Additionally, alcohol intake, which we'll talk about in a moment. The main thing that we're concerned about when we're talking about your diet when you're on warfarin is how much vitamin K you're getting. So dietary sources of vitamin K include your green leafy vegetables, broccoli, Brussels sprouts, even some cashews, that type of thing. So what's important is that you're maintaining a consistent, balanced diet. We just don't want any peaks and troughs of vitamin K. Some people might find if they all of a sudden go on a juice cleanse and they're having a lot more green leafy vegetables than usual, then they might find that their warfarin dose all of a sudden isn't enough for them anymore, and that dose needs to increase. And so that would be a sign of a bit of a drug-food interaction. The important thing is that you're stabilized on your warfarin dose based on what you were eating at that time. So it's important that you're just keeping that consistency and not trying to go on health kicks for a week and then kind of giving up on that the next week, just because then you'll really find that your INR is fluctuating a lot. As for alcohol, acute ingestion of alcohol will increase your INR, but chronic ingestion over time can decrease your INR. There are plenty of drug interactions with warfarin. The bottom line here is just to make sure that you're talking to your healthcare provider, whether it's your pharmacist or your doctor, and getting before you start to take anything new. And that includes any supplements or over-the-counter medications. You just want to have a little bit of an interaction check before you add anything new to your regimen. The next type of anticoagulant that we'll talk about are the direct oral anticoagulants. So the more common ones would be rivaroxaban and apixaban. So these are the new alternative to warfarin, as they work on different clotting factors. They do achieve the same result, but there are less drug and food interactions to worry about. There's no need for the frequent INR monitoring with these ones. However, the drawback is that they are more expensive than warfarin. The next type of anticoagulant that we'll talk about is the injectable anticoagulants. So this is either subcutaneous, so just right under the skin, or an intravenous infusion periodically. So these include heparin, enoxaparin, dalteparin, fondaparinux, and these act similar to warfarin. However, we typically use these on a more temporary basis. So for those of you who were in the hospital, you might have been on dalteparin for a few days or some enoxaparin. These ones act quickly, but they also leave your body quickly. Next up, we'll talk about statins. So I'll let you guys watch this video just to get a nice visual about what we will be talking about.
Cholesterol is a fat that travels in your bloodstream through your body. Your cells use cholesterol as a building material. Over time, a lot of cholesterol can build up inside the walls of your arteries. A buildup of cholesterol causes fatty streaks to form in your arteries. This is part of a process called atherosclerosis, which narrows and stiffens the arteries. The longer the cholesterol sits in the artery walls, the harder it gets. Eventually, a fatty streak can get so large and hard that it cracks, causing a clot to form around the crack. This clot can block the artery, causing a heart attack or stroke. It's never too late to make changes to protect your heart. Think about your future, being there for your family, your plans and dreams. Could your cholesterol and risk of heart attack or stroke affect this?
A few of the more common statins that you may have heard of or that you may be on are atorvastatin or Lipitor, simvastatin, rosuvastatin, or pravastatin. And these medications are usually used indefinitely after a cardiac event. Within our body, 75% of our body's cholesterol is made in the body, whereas only 25% is obtained from the diet. Statins work by blocking the enzyme in the liver that produces cholesterol. So this helps to prevent the buildup of plaque in your arteries and stabilizes any existing plaques that you already have and makes them less likely to rupture. So the benefits extend beyond just lowering your LDL or your bad cholesterol. After a heart attack, almost everyone is started on a statin regardless of whether you have high cholesterol or not. And that's just because these will help to prevent that plaque formation in your arteries. You can think of plaque as clogging the drain, and if that plaque ruptures, that's when you can experience a heart attack or stroke. The main thing that we're showing on this blood cholesterol goal slide is just that your LDL, that's your bad cholesterol, that's the one that's clogging your arteries, whereas HDL, you can think of as your healthy cholesterol. And your HDL helps to keep your arteries clear of that plaque. Statins work by decreasing the LDL cholesterol, and they can actually help to increase your HDL or your good cholesterol in the body. As for side effects with statins, the main one that people might experience is some stomach upset. So constipation, diarrhea, nausea, gas. If you do find this, again, try taking it with food and see if that helps. If you experience some muscle pain or weakness, this would be something to speak to your doctor about. Sometimes what your doctor might do is switch you to a different statin or even possibly reduce the dose to get you more comfortable. It is important when you're on statins to avoid grapefruit juice and coenzyme Q10, as these can increase the drug effect of your statin and increase the side effects of your statin. Now we'll watch a video on how beta blockers work.
Your heart pumps blood around your body through a network of blood vessels, known as the circulatory system. Your blood then supplies the cells in your body with the oxygen and nutrients they need. If your doctor has prescribed you beta blockers, such as atenolol or bisoprolol, it may be because you have an abnormal heart rhythm, or angina, or heart failure, or had a heart attack. Beta blockers work by blocking the actions of hormones called adrenaline and noradrenaline. These hormones make the heart beat faster and with more force. Blocking them makes your heart beat more slowly and with less force, which reduces your blood pressure and the strain on your heart.
On this slide are a few of the more common beta blockers listed: bisoprolol, metoprolol, atenolol, and carvedilol. So all of those ones that end in olol. Your beta blockers work by lowering your heart rate and your blood pressure, and this helps to reduce the workload on your heart and help you recover more quickly and lower the risk of further damage to your heart after a cardiac event. As for side effects with beta blockers, dizziness or low blood pressure would be the main one. We want to make sure that after starting any new blood pressure medication that you are a little bit more cautious when you stand up. You don't want to stand up too quickly after you've been sitting down for a while or when you first wake up in the morning, because that's when you might get that bit of a head rush and feel dizzy, and then we're at risk for falls. So just being very cautious to take your time when you're standing up, maybe kick your legs out and get your blood moving a little bit before you stand up. If you are finding that you're having frequent episodes of this dizziness, that would be reason to talk to your doctor because your dose may need to be adjusted. Additionally, you might find that your heart rate is lower. cold hands and feet. You might just feel a little bit exhausted, but tiredness and exhaustion is one of those side effects that's difficult to tell if it's from the medication or if it's from the trauma that your body just experienced, as your bodies are in recovery right now as well. If you are a diabetic, it's important that after starting a beta blocker that you are monitoring your blood sugar a little bit more carefully, just because this medication can reduce your blood sugars and also can actually mask some of the symptoms of low blood sugar. So that trembling and fast heart rate that you might feel when your blood sugar drops, beta blockers can mask that effect. So make it a little bit harder to tell when your blood sugar is dropping. So more frequent monitoring until you know how it affects you is a good idea. The next medication we'll talk about are the ACE inhibitors, or the angiotensin converting enzyme inhibitors. So these are all the prils: ramipril, enalapril, perindopril. ACE inhibitors help to lower your blood pressure by inhibiting the formation of angiotensin II hormone that causes the narrowing of blood vessels. So this results in relaxed arteries, reduced blood volume, and therefore reduced blood pressure. This helps to protect the heart and helps your heart get stronger. ACE inhibitors can help to increase survival after a heart attack and reduce your risk of having another heart attack. As for side effects with ACE inhibitors, again, with that dizziness and low blood pressure. So please, whenever you're started on a new blood pressure medication, just be a little bit more cautious about standing up quickly. The main annoying one that can be quite bothersome with ACE inhibitors is a dry cough. Not everybody does experience it, but about 10% of people can develop this at any time. Usually it's within the first few months. This dry cough, unfortunately, does not get better with time. And so if it is bothersome, you can speak to your doctor about switching to a different class of medications that we'll talk about in a moment here. The other thing is that ACE inhibitors can increase your potassium levels. So your doctor will be ordering more frequent blood work just to keep an eye on your potassium levels to make sure that they're not going too high. For patients who have found an ACE inhibitor a little bit hard to tolerate, maybe that dry cough is driving them crazy, there are the ARBs, or the angiotensin receptor blockers, which is a similar type of medication, again has the same result, but just with a slightly different mechanism. So these are all of your sartans. Irbesartan, telmisartan, candesartan, and valsartan are some of the common ones. So the ARBs work by blocking the action of angiotensin II to help lower blood pressure and prevent damage to the heart and kidneys. So again, the same beneficial effects as ACE inhibitors, but without that pesky dry cough. Unfortunately, there's always a drawback. These are more expensive than the ACE inhibitors. Now we will talk about nitroglycerin. Nitroglycerin helps to relieve chest pain. It does this by dilating your blood vessels, making it easier for blood to flow through, and letting more oxygen-rich blood reach your heart. So this helps to prevent and treat any chest pain that you're experiencing. Better blood flow means that your heart doesn't have to work as hard. So nitroglycerin comes as a spray, a tablet, or a patch. On this slide, it just demonstrates how to use nitroglycerin spray. So it's important that you're priming the pump with a new bottle if it hasn't been used for 14 days. So that means just spraying it into the air until you see a mist, just to make sure that when you are spraying it under your tongue, you're getting that full dose. Please don't shake it, as that can introduce air bubbles that can prevent you from getting your full dose. So when it's sprayed under your tongue, it usually will provide immediate relief of chest pain. If it does not, you can use one dose every 5 minutes up to a maximum of 3 doses in 15 minutes. If after you have received 3 doses and your chest pain is not going away, get to the hospital or call 911. Nitroglycerin patches are something that can be used, and this releases nitroglycerin continuously throughout the skin to prevent chest pain. It is important with these patches that you take them off at nighttime just to have a bit of a nitrate-free period, just to prevent any tolerance developing. It also is important to apply a new patch to a different spot each time, just because if you kept putting your patch at the same spot, your skin can get irritated. Side effects of nitroglycerin include headache, flushing, or again, that dizziness and low blood pressure. So please do make sure that you're sitting down when you're spraying it under your tongue or taking a tablet under your tongue. If you are on the patch, your body does get accustomed to these side effects. So these aren't quite as noticeable when you're on just that slow, steady release of a transdermal patch. The main drug interaction that we really want to make sure everybody knows about is nitroglycerin with medications such as Viagra or Cialis. So the risk here is that when used together, they can drop your blood pressure to a dangerous level so that your brain, kidneys, and organs are not getting enough blood and you can go into shock. So we call this a hypotensive crisis. Now we'll talk about some sexual dysfunction. So there's a few culprits. Firstly, you are recovering from a major stressor, so your body is still in that recovery mode. And now we're also adding on these medications. So beta blockers and diuretics can also contribute to sexual dysfunction. So why does this happen? When we're dilating blood vessels, reducing heart rate, and removing water or volume from your blood, we're reducing blood pressure. However, a reduction in blood pressure also means a reduction of blood delivery to your reproductive organs. What can we do about sexual dysfunction? So a few non-drug things that you can do to increase blood flow include stopping smoking, reducing alcohol consumption, losing weight, increasing exercise, and reducing stress. You can also speak to your doctor to see if any changes in medication or dosage is possible. However, given what your body has just went through, they might be reluctant to agree to that. Thirdly, you can add a PDE5 inhibitor. So these are the medications that we know as Viagra, Cialis, Levitra. And again, we'll remind you about that nitroglycerin interaction. So the PDE5 inhibitors, these are contraindicated in anyone who's using nitroglycerin regularly. So if you're using a patch or if you're frequently needing to use the spray or tablet, then you cannot use any of these medications such as the Viagra and Cialis. Both of these medications, as mentioned, can dilate blood vessels and reduce blood pressure and get you into a life-threatening situation if used at the same time. Those who take nitrates only on an as-needed basis, they can use the PDE5 inhibitors, but just need to be aware of the restrictions. So nitroglycerin can't be used within 24 hours of Viagra, and it can't be used within 48 hours of Cialis. And also cannot be used within 24 hours of Levitra. Moving on to grapefruit juice. The thing with grapefruit juice is that it interacts with so many medications, and what it can do, it prevents some medications from being broken down, and so therefore increases the amount of certain types of medication in your blood. So what would be easiest is just to avoid grapefruits and grapefruit juice. However, if this is something that you really enjoy and taking grapefruits out of your life would be devastating, then speak to your doctor, because we can always switch you to a different medication within the same class where maybe there aren't interactions or more minor. A few other medications to beware of are frequent use of NSAIDs. So those are your non-steroidal anti-inflammatory drugs, things like ibuprofen or Advil, Motrin or naproxen or Aleve. These medications can increase your risk of heart attack and stroke and increase your blood pressure and increase your bleeding risk. So if you are needing to take something for pain, Tylenol would be a safer option. The use of Voltaren or diclofenac gel just on your skin is okay, just because there's not as much absorption into your bloodstream of that one. Additionally, cough and cold medications with decongestants, those can increase your blood pressure and heart rate. If you're picking up a combination cough and cold pill, please do just ask the pharmacist just to confirm that there are no decongestants and that it is a safe medication for you to be taking. Also, avoid highly concentrated caffeine. So, giant coffees, energy drinks, those can increase your blood pressure and your heart rate. Another thing to be cautious of is taking unnecessarily high doses of calcium supplements or antacids. So spikes in calcium concentration in your blood, like from these supplements, can increase your risk of heart attacks. So we advise against self-prescribing, but that being said, a lot of people are advised to be on calcium and vitamin D, and that's okay to be using in regular recommended amounts. So don't worry about avoiding them entirely, but we just don't want anyone to be taking any mega doses of calcium. Omega-3 fish oils. So this is one supplement that we do recommend taking. So this is a type of polyunsaturated fat, and some of the benefits from omega-3s include lowering your triglycerides, reducing inflammation, improving your healthy cholesterol, improving plaque stability, preventing blood clots, and lowering blood pressure. So the best way to get omega-3 is through fish. Fish in your diet, cold water fatty fish such as salmon and tuna. And the ideal to aim for is 2 4-ounce servings per week. If you are using a supplement, what we recommend is a combined EPA/DHA of 1,000 milligrams per day for secondary prevention of any cardiac events. And this is usually well tolerated. Sometimes taking it with food can help to prevent stomach upset. The main thing that you might get are some fishy burps. If you're a vegetarian, you can get omega-3 from chia seeds, hemp seeds, flax seeds, or omega-3 rich eggs. In general, herbal products are not something that we recommend. A healthy diet, regular exercise will do more for your cardiac health than any supplement on the market. A healthy diet will get you all of the vitamins and minerals that you need, except for maybe vitamin D, with us living here in cold Manitoba. Buying multiple supplements will also be very costly and can end up costing you more than just buying healthier foods would have. The benefit of a lot of herbal products can be significantly less than what is offered from prescription medications in the same class. So a lot of herbal claims are not proven. The benefit can be overstated and the risks understated. And oftentimes the statistics that are provided are by their own company and not an actual regulatory body. And a lot of the risks with herbal products are unknown, and you can wind up increasing your bleeding risk or increasing or decreasing the amount of your prescription medication in your blood. Many of us will have well-meaning family members who maybe heard or read that a certain medication is, or a certain herbal product is great to take after a heart attack. However, it's always wise to just confirm with your doctor or pharmacist if it's a safe bet before picking it up and spending the money on it. Of course, quitting smoking is something that we advise. So smoking contributes to buildup of plaque in your arteries. It increases your risk of blood clots, reduces oxygen in your blood, and therefore makes your heart to work harder. And right now your heart is a little bit stressed out anyways. Quitting smoking can lower your risk of having another heart attack by about 50% after 2 years, and your actual chances of having a heart attack start to go down after just 24 hours of being free of cigarettes. Quitting smoking and the use of those 4 preventative medications can actually reduce your risk of having another cardiac event by 80%. As for vaping, evidence is emerging about the toxic effects of e-cigarettes on the cells that line your mouth, your nose, lungs, and blood vessels. And vaping is actually also linked to respiratory injury and increase in blood pressure as well. So vaping is not necessarily a safer bet than cigarettes. There are options to help you quit smoking, such as nicotine replacement. So that includes gum, lozenges, inhalers, spray. And there's also prescription medications such as Wellbutrin or Champix that can help. And here is a list of resources that can help you in your journey to quitting smoking. Additionally, cannabis is another thing that you might be wondering, is it safe? Is it not? There is little high quality evidence about the impact of recreational cannabis on heart conditions. So research has shown that cannabis can increase heart rate and oxygen demand, increase blood pressure, increase platelet activation, and cannabis has been linked with heart attacks, arrhythmias, heart failure, stroke, and cardiac arrest. So again, best to avoid it. Cannabis is not necessarily only a combination of THC and CBD. It can also include 500 additional compounds, and the safety of those and the effect on our body is not necessarily known. We need more research to fully understand the effects of CBD. The risk of heart attack is elevated almost 5 times in the hour after smoking cannabis. And lifetime risk of heart attack is increased up by 8% in recreational cannabis users. Moving on to alcohol. So short-term use of alcohol can reduce your blood pressure, whereas chronic or long-term use can increase your blood pressure. It also can increase your heart rate and increase your risk of cardiovascular disease. There's also some drug interactions of alcohol with medications that can increase your risk of dizziness and also increase your bleeding risk. So these health risks usually start once you're drinking more than 3 drinks per week. And cardiovascular specific risk increases significantly when you have more than 7 drinks per week. Moving on to things that can help to reduce your risk of getting any further trauma to your body. So flu shots and COVID yearly vaccines are a great idea. Your body is still recovering. We want to help to prevent any further stress on your body, just because getting the flu or COVID when your body's in a bit of a vulnerable state, it can hit you a lot harder than it would when you were at your healthiest. So getting the COVID and flu shots yearly can really help to reduce your risk of having second major cardiac issues as well. Side effects of these shots include injection site irritation. Some people do end up getting fever, muscle aches. It's not the actual flu. It's just side effects of this inactivated virus. On a similar note, getting the pneumococcal vaccine. So eligibility will depend on a few factors. If you're under 65, you can receive 1 dose of Pneumovax 23 for patients with chronic cardiac disease. If you're 65 and older, you can receive another dose of Pneumovax at least 5 years after the first dose. And this vaccine is offered by Manitoba Health for free. You might find that being on all of these new medications can be overwhelming. So if you are needing a little bit of help with medication adherence, making sure that you're taking your medication properly and that you're remembering to take it, there are a few different methods that can help. So first of all, if you have a dose set or a pill organizer, then once a week, you can put your pills in those pockets, and then you know if you've taken them, and you won't have to at noon wonder if you took those morning meds or not. You can look back and see. There are also some apps for anyone who's tech savvy. A health app or the MediSafe app can help. Also, if you're finding that it's too much and maybe you are on plenty of other medications, asking your pharmacy to blister or bubble pack your medications can help to take any guesswork out of your medication regimen. That brings us to the end of the presentation. Any questions, please let us know. Hopefully everyone feels a little bit more comfortable knowing what each of these new medications is for. Thank you.